What is the tubal ligation reversal and how successful is it? Here we're talking about a situation whereby a patient have opted 5 or 10 years for tubal ligation or what you call sterilization by surgical method, where the tube are either cut, cauterized, or a clip is being put on the tube. Now, the question we're trying to answer, or how successful if such a patient decided later to come and say, open the tubes because I want to have more children. A tubal ligation reversal is a reconnection of the tube which is being intentionally blocked surgically or cut a segment or a part of the tube being cut as a segment and closed so that that person cannot be pregnant naturally. Then by reversing, it means removing that obstacle or obstruction so that that particular patient can be pregnant naturally. In other words, you're correcting or reversing the ligation. Who is a good candidate for this procedure, or who can qualify to do this procedure, which is tubal ligation? The type of tubal sterilization is very important. That history, it should be given to the surgeon who will be helping you to reverse your tubal ligation. Most likely, if the histology has been taken, the pathologist may give the length of the tube which has been cut off. It's very important to know what's the length of the tube because we know that if you do tubal reversal and the length of the tube which has been taken is more than 4 centimeters, then you are left with roughly, because the length of the normal tube is about 7 centimeters, therefore you are left with 3 centimeters. Therefore, you'll have a shorter tube which is actually reversed, and the chances of that tube picking up the eggs in the opposite ovary are very small. Therefore, the length of the tube is very important during the tubal ligation reversal. The age of the patient as well, and the AMH, anti-Mullerian hormone, which is a biomarker of ovarian reserve, how many eggs which you have still reserved, or how high or what are the chances of you to get pregnant with your eggs. Sperm analysis is very important as well. It's rather not a good practice to do tubal reversal where intending that the patient should be pregnant naturally if the husband or the partner have no sperm at all. Therefore, the procedure won't be helpful. Or if the partner have a very, very low sperm, or if the partner have sperm anomalies. It's very important as well as a patient, if you want to reverse, you should look at the body mass index, which must be below 25. Health condition and general fertility should be also looked at. What happened during the laparoscopic tubal reversal? Laparoscopic assessment of the sterilization or the sterilization method is done during the same procedure. Therefore, it will be very difficult and not a good practice to go and look at the tube and under anesthesia and then come back and tell the patient we can do sterilization or not, we can reverse the stereo or not. In that case, the patient must go back the second time to theater. Therefore, it's very important that you get most information from the history and from histology part. Then you can then go ahead and do tubal reversal. There are several methods of sterilizing the tube or of making or of doing what is called sterilization. It can be done laparoscopically. Usually fillet clips or rings are put in. It can be done abdominally, usually during a cesarean section. And in this case, majority of time, a large part of the tube is removed. It can be done hysteroscopically, or you can do it through a mini lab in which also you can tie and cauterize the tube. How soon can I recover after I had tubal ligation? Tubal ligation is a same day procedure. In other words, it's a procedure which is done as an outpatient on a day, fine, and it takes you about 4 hours in the hospital and you get discharged. Within 1 week, you should be able to be back at work. It's less painful, shorter hospitalization, and less complication if you do it through laparoscopy. However, the skill of the surgeon who's doing laparoscopy sterilization is very important. Therefore, a skilled surgeon who knows to tie knots, who knows how to operate with the laparoscopy is very important, or it's a mandatory to do such a procedure. A one-stitch method for tubal ligation is very poor method of doing this procedure because the results are very poor and the pregnancy rate is extremely low. What is the pregnancy success rate in this procedure? In general, tubal ligation is chances of pregnancy are very, very, very well. In other words, the chances that you can get the tube properly reversed is about 50 to 80% per procedure, and depending on the type of sterilization which has been done. Therefore, the success rate of this procedure really lies on, as I said, something like semen analysis, which is the investigation of the partner, length of the healthy tube, which is available for the procedure. I would say if that particular tube is, you can be able to at least have 4 centimeters of the tube reserved and can reverse it with 100% pregnancy rate. The presence of any pelvic scarring or adhesions also it's probably will decrease the chances of pregnancy after tubal reversal, and any inflammation or chronic or even hydrosalpinx of the remaining part of the tube usually make the procedure very difficult and with poor success rate. The type of sterilization as well is very important, as I know whether it's been done laparoscopically or abdominally, and how much of the portion of the tube has been removed, and the age of the patient goes also may assist us in increasing, or if the younger the person below 35, we know that when you compare IVF and tubal reversal, the patient below 35, tubal reversal is actually a high pregnancy rate compared to IVF. Therefore, age of the patient is very important. In this, I'll show that below 35, you've got 70 to 80% chances of pregnancy in patient get a reverse with good tubes. And above 40%, you're looking at 30 to 40%, which is definitely in the range of IVF. Therefore, above 40 IVF and tubal reversal, they are equal, or chances of pregnancy are the same. And below 35, tubal reversals got high chances, or pregnancy chances are increased. But remember, the whole procedure rely on the skill of the surgeon. The good the surgeon in doing tubal reversal, the better the outcome. What complication can I expect if I do tubal reversal? Although they are rare, you may be anesthetic related complications. You may have bleeding, infections, and also very, very important after this procedure is to understand that After tubal reversal, you need to take at least 3 menstrual cycles without attempting to pregnancy during that time, so that the tube can heal properly. Then after you can attempt pregnancy, you say 3 months. Then after that you can. If you do attempt to get pregnant earlier than that time, the chances that you'll have ectopic pregnancy are very high. Then we're looking at something like 3 to 5%. Therefore, it's very important that the rules, for really after you've done the procedure should be followed. What are the alternative to tubal reversal? Yes, IVF, ICSI, and so forth, they are definitely indicated as well. They give high success rate pregnancy wise, but tubal reversal per se, or uh, this procedure is meant for certain group of patient, especially patients with only segmental, which is a part of the tube which is sterilized, closed, then is been removed and reconnect. Therefore, they do very well when they go to natural conception. In conclusion, it is possible to reverse tubal ligation and a very high success rate. This we're seeing basically in patients who are below 35, where the success rate goes to 80%. However, there are many factors to consider when deciding to reverse the tubes. That include the cost, that include the age of the patient, that includes the healthiness of the tube, and that is include as well the sperm count and the general health of the patient who's getting that procedure as well is very important. Thank you.